Hi, I'm Dr. Julie Steinauer. In today's video, I want to talk with you about what can you expect if you are in our program for reduction of your lens prescription. Or maybe you're in our program for something else and we've told you, hey, we can do that too. First, let me tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and you'll have two choices there. The first thing that you can do is if you want just more information and you want to start kind of chatting with us, you can fill out the questionnaire. We will give you some feedback as to what's going on with your vision and what you might be experiencing. And the second option that you have is maybe you've been a YouTube follower of mine for a while. I have been doing this for, oh my goodness, 9 years actually. And so if you've, no, 10 years this year. Oh, okay, so 10 years this year. So if you've been a YouTube follower of mine for a while and you're just ready to take that next step, then you'll want to click on the schedule a consultation button. Okay, so now let's go back and talk about what can you expect when you're going through our program. And we've either told you, yeah, you can have a reduction in your lens prescription, or maybe that's the specific thing that you came to us for. Well, first off, you know I love my Syntonics, and I talk about these in almost, not all, but almost every video. And so key and integral to your program, if you're wanting to do lens prescription reduction, so like reducing your myopia, your hyperopia, or your astigmatism, which means your nearsightedness, farsightedness, or astigmatism, which is that kind of shape of the eye being flat in one area. If you're wanting to reduce those things, specifically, you're going to have kind of a yellowish orange type of filter similar to this one that you're going to be working with. You'll use those lenses, 2 different sets of them daily, 5 days a week, every week. And you'll use those in order to be able to kind of start electrically rewiring your brain. Now, it's interesting that our patients typically notice some really big changes. And of course, this isn't for everybody, so I'm not saying this is 100% across the board, but our expectations for most of our patients are generally that we should see a reduction of astigmatism around about 40 to 50%. What? All right, so that's crazy. Now, some of our patients only get a 30% reduction. Some might get a 10% reduction. There are a few cases that's case by case that we would kind of tell you that. And we typically will tell you what we expect to see happen for you. Now, what about being farsighted? Okay, so farsighted, we typically can see somewhere around a 30% reduction in that power of your lens, especially if you are a higher power. So let's say that your lens is like over a +3, like a +4, +5, +6, +7. Those usually are going to decrease by at least about 30%. In some cases, for kids particularly, we may notice more like an 80 to 90% reduction in that power. So going from those thick Coke bodily lenses that make their little eyeballs look so huge, even though they're precious that way, they might not like it so much. So we can reduce the thickness of their lens, decrease their farsightedness, and overall, it's not just about cosmetics that we're working on here. We're really concerned about how the eye and brain connection is working together so that they have their absolute best vision, and without something that's thick Coke bodily kind of in the way, impeding how they interact in their world, whether they like to ride a bike, go swimming, they like to read, or whatever it is that they like to do. And this stands for adults too. Now, adults we may not see an 80 to 90% reduction on, but we will see a healthy 30, 40, sometimes 50% reduction on you. Now, what about that myopia or that nearsighted part? This is one of those that people contact our office about all the time. How much can you expect to see my myopia reduce? Well, quite a lot. It kind of depends. One of the things that we have to do is we have to help you to get used to something called blur acceptance. Blur acceptance is whenever you look off at distance, it doesn't have to be so crystal clear that you can see a bug from 20, 30 feet away on the wall. Or like the lines on a leaf on a tree, or the vein down the middle of the leaf on the tree from 30 yards out, right? So we get you ready for something, like we get you ready for the reduction by helping you get used to what's called blur acceptance. If you tolerate that and you do really well, now, typically, this is where I also have to toss in. It doesn't work out as well if you're a type A personality that needs to have things very, very rigid. If you're not, though, this definitely will work for you, and we can reduce your lens prescription usually around 30%. But we do have instances where we're able to reduce it even more around 50, 60, or 70%. Every case is a little bit different on myopia, and certainly when we look at your numbers and what your situation is, we can typically give you a pretty good idea of what our expectation is. And we'll also base that on your personality, because again, a type A personality who's like super critical, wants everything exact, doesn't like it if they can't see things perfectly, you'll get some reduction, but you're not going to get as much as you want. If you're not a person who kind of is like, you know, hey, I even sometimes go around the house without my glasses on. That person is definitely tolerating what we call blur acceptance, and they're an excellent candidate for reduction of their myopia or nearsightedness. Now, I talked about a lot. You can go to our website and do one of two things. If you're not local to us, you can click on the schedule a consultation. If after this you're like, okay, I need to talk with her, okay? Then click on that schedule consultation button and set up a time to consult with me. If you're just wanting to learn a little bit more, I really, really highly encourage you to fill out the questionnaire. You'll get some cool feedback. There's some neat features like, you know, wah, wah, warning, 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 your vision needs correction now, okay? So you'll get some information like that from us. And it also just gets you in the system and keeps you in the loop with us, as far as like we will communicate with you periodically, and you know, as we grow our relationship, maybe down the road you'll be comfortable and you'll want to take a step forward with us to start some therapy. Now, if you are local, call us at 618-288-1489. If you like this video, hit the like button. Definitely subscribe to our YouTube channel and hit the bell icon for all of our videos so you don't miss anything. We talk about a wide variety of topics. Things that you would never even think we would talk about, we're probably going to cover those too. And if you feel like this could be beneficial, maybe you know someone who's been talking about they really want to reduce the lens prescription of their glasses or contacts, and they're not really interested in doing something surgically. They'd like to do it holistically. Pass this video on. Thank you.